So yesterday we talked about A2, A3, and F1. Okay. So basically, A group belongs to blood remedy. Okay, sanguine temperamental remedy. It will work on blood producing organ, blood circulating organ, blood utilizing organ, and blood purifying organ. So all these four can be treated with the help of A groups. Okay. So A1 already we studied that it will work on left side of the heart, arteries, arterioles, and capillaries, and also improves the circulation and also work on blood producing organs and and if the circulation issues are there, you can use A1, okay, like ischemic disease, okay, or any heart disease, okay, any issues in arteries, arterioles, okay. If the circulation is sluggish, we can use A1. Okay. Next, we have A2. So A2 belongs to left, right side of the heart and veins, and mainly it concerned to the remove the impurities which is present in the veins and in the cells. Okay, it will release all the impurities from that area and it make them purify and it will remove the toxic substance which is causing harmfulness in the body, okay, which is as a result the person have disease, okay. A2 for purification of internal toxic substance, okay. So this is very important remedy. So we use in gangrene, okay. We use in all types of ulcers, diabetic foot ulcer, okay, or any wound, non-healing wound, stomatitis, okay, non-healing ulcer. So A2 will give wonderful results. Okay, next we have A3. A3 is I already told you that master of fluid, chief remedy of blood, chief remedy of blood. So whenever we need all types of nutritive things to the organ, to the any part of the cell, any part of the body, so you have to use A3. Okay. Next, we studied about F1. So F1 will work on CNS and PNS. Mostly it will work on CNS and PNS. So along with other remedies, you can add F1 wherever you want to uh, give the effect of nervine. Okay, like one example, I want to give S1, F1. S1 is uh, lymphatic temperamental patient remedy. F1 is for nervous system. So you want to give nervine effect to the lymphatic temperamental patient. So nerve signals are very decreased to the lymphatic temperamental patients. So you are giving nervine effect to the organs. Okay. And another example, S5F1, S1, S5F1. So to regulate the metabolism. So nerves continuously will give the signals to improve the metabolism. Okay, S1, S5 for metabolism, F1 for nervine effect to the metabolism. So what you can do the metabolical effect. Metabolical uh, effect will increase with the help of F1. As F5 itself give the metabolical effect, but F1 will add upon give the nervine effect to the metabolism. Then the results will come very fastly if any requirement is there. If in example, if a person is depressed, anxiety, always in tension, okay, he kept himself single, Okay, he are not able to talk to anyone. Okay, always thinking. So that person metabolism is also affected. So along with F1, he need S5. So we are giving combined remedy S5 and F1 to work on his temperament as well as his nervous system. Okay. So now we will talk about F2. So in F2, we have 9 plants. Excuse me. So in the F2, we have 9 plants. What are those plants? Aciculus hippocastrum is the first plant which is present in the F2, Aciculus hippocastrum. And second one is Berberis vulgaris. Third one is Ettigaria centurium. Ettigaria centurium. And fourth one is Centriria eclandica. Okay. These are present in F1 also. Okay. These plants. Cinchona calisaya. Okay. And sixth one is Cinchona saxiribra. Okay. This is the sixth plant. And seventh one is Salix alba. And eighth one is Sambucus nigra. Sambucus nigra. And ninth one. This is very important plant. This is in the place of uh, aconitum. We have another plant that is Scolopendrium vulgare. Scolopendrium vulgare. This is the plant which is present in F2. This is the main important plant. In the place of aconitum, here we Dr. Count Cesar Mete added Scolopendrium vulgare. Scolopendrium vulgare. So these are the 9 plants. So it is designed to work on central nervous system and peripheral nervous system. But F2 mainly concern, it will work on both, but mainly concern on peripheral nervous system. Peripheral nervous system, and mostly it is give benefit to apply externally. Whenever you need, whenever you need uh, nervous issues are there. So whenever you need F group to give to the patient, so you have to give internally F1, externally F2. So then both can activate the nerves which are degenerated, okay, gradually. So like one example, I will give that in the cervical spondylosis, we have cervical disc is used, cervical uh, pain. So at that time, so you have to give internally F1, F2 to apply. So which dilution you will give? So according to the condition of the disease, it may be acute, subacute, or chronic. So whatever dilution you are giving internally, externally, that dilution had to be applied. Okay, this is the basic thing. But along with F2, you can add any other remedies also. Like internally, you can give F1, A3. Okay, like you can apply F2, A3 also. If necessary, if any other issues, you can add any other problem also. Like our body's polarity. One side is positive, another side is negative. Okay. So according to the positivity, negativity, you can add electricities. Okay. So F1 RE, F1 WE. Okay. Likewise, electricities can be added. Okay. So externally, it will work wonderful. Okay. Its results, Dr. Count Cesarmeta has seen that F2 mostly work on externally because we have motor and sensory nerves. Okay, motor and sensory nerves. The nerves which are coming from the brain, these are the motor nerves. The nerves which are going to the brain, these are the sensory nerves. So basically, when you apply F2 on the particular area, okay, this is the required area where you have to apply. So you applied F2 here. So the concentration of medicine will go through these nerves to the brain, and the particular area will act and it will heal the particular area where the damage is. Okay, so this is the minimal process how the body heals the damaged area. So here F2 works on sensory nerves mostly to reach the affected part of the brain, and the affected part of the brain will cure the particular area. So F2 mostly will be applied externally. So here how it works, I explained very clearly. It will work by sensory nerves. Okay, to activate particular area. Okay, so this is all about F2. Now we will talk about another group, that is we completed S group, Stropholoso group, we completed L group, okay, we completed A group, we completed F group. Remaining we have Ver group. Now we'll talk about Ver group, Ven group. Okay, next we have P group, and last we will talk about C group. Okay, next we have electric cities. Okay, so next now we'll talk about Ver group. So what is Ver group? Ver group full form is Vermifugo. Okay. Vermifugo group. Okay. So basically it is designed to work on worms, microbes, or parasites. So basically, I think that our Dr. Kaun Cesar Mehta, he designed this remedy to remove the effect of parasites from the body. Okay, it may be uh, coming from the external environment, or our body produce the internally. So both can be treated with the help of vermifugo. So whenever when most of the children have this worm issues, ringworm, okay, other types of worms are there. So they have itching in the anal region, and they treat with gridling sound. Okay, they produce, and they have a habit to eat sweet sugar mostly, and they eat sand. Okay, so because of the worms. So at that time, in his period, I think so that this is the most common issues he saw in the children. Okay. So there's the reason he developed one remedy which will work on intestine, say okay, mostly large intestine, which will remove this effect which is producing by the internal environment or maybe external environment. Okay, so this is very important because uh, not only children's nowadays Young adults are also having worms. Those worms will entering into the brain and causing numerous diseases. Okay, so that's the reason it is the best remedy to treat the worms, not only worms, worms like effect which are producing other things also. It may be food, it may be water, it may be anything. It may be our own body. Okay, so Vermifugo group is designed to work on to remove the effect of the worms. It may be from the internally, it may be from the externally. First thing, very important. Second thing is that it works on intestine, mostly on large intestine. Okay, this is the second most important thing we have to remember. And third thing is that when it works on large intestine, it's indirectly work on brain also. It refresh the brain. It remove the toxicity from the brain. Okay, because we have lot of connection between brain and the intestine. Okay, so direct connection between nerves of the brain and intestine. Now the lodge of plexus are there, so which are connected to the connected to the intestine. So indirectly it will work on brain also. So the main remedy is for worm remedy, anti-worm remedy. Second is it is the intestinal remedy also, and third one is it is indirectly it will work on brain also. Okay, so basically if a problem occurs, so you can treat with Ver group also along with F group. Okay, this is how to remember. So what are the plants are present? How many plants are present? What are the plants present? We have first plant, Allium sativum. Okay, first plant, and second one is Chenopodium anthelmintic. Okay, anthelmintic. This is the second plant, Chenopodium anthelmintic. Third one is Euphorubium officinale. Euphorubium officinale. And fourth plant is Dictamnus albus. Dictamnus albus. And fifth plant is Ruta gravulens. Ruta gravulens. This is the fifth plant. And sixth plant is Thymus serpillum. Thymus serpillum. And seventh plant is Imperatoria osrotrium. Okay, this is the seventh plant. So how many plants it have? It has 7 plants total. So this is the thing we have to remember regarding vermifuge. So which remedy along with F1 will work wonderfully? We have, because it is the intestinal remedy, you have to select along with intestinal remedies also. C10, okay, C15, the best combination, and you have S10 in electricities you can use along with YA. Okay, because you have to decrease, you have to use negative electricity, which will decrease the effect of the worms. Okay, so it will release all the impurities from the intestine with the help of Ver group. So this is the best remedy along with Ver. Next we have Vermifuge group 2. So Vermifuge group 2 same also, it is also anti-worm remedy, but you have to use externally like F2. Okay, same problems you have to treat internally, Ver1, externally, Ver2. So what are the plants we have? Allium sativum, same first number plant, Allium sativum. Second one is Chenopodium anthelmintic. Okay, this is the second plant. Third one is Dictamnus albus. Okay, Dictamnus albus is also present in Vervon. And Rota graveolens. This is the Rota graveolens. And Artemisia china. Okay, this is the new plant. Artemisia china. And sixth one is Tanectum vulgare. This is also a new plant. Vulgare. Spigelia and Thilmia. Okay, so in the word two also we have seven plants. So word two and word one works on same issues, but word two externally, word one internally. And second thing you have to remember about word two, it works like F2. Word one like F1, word two like F2. So because we have 2 to 3 remedies, which are wonderfully which give results to you, in that F2 and Go2 are very good result oriented medicines when you apply externally. Okay, so I think you understood about Word2. So along with Word2, you can use F2, I told already. Along with Word2, you can use A2 because it is releasing the toxicity. Along with Word2, you can use GE to overall increase the effect of Word2 externally. Like wound, we have wound, no? We have ulcer. So where you can use A2 Word2 G externally, or it have nervine. You want to a nervine effect, you can add F2 to heal more uh, fastly. Okay, so this is the remedies we can use along with word two. So we can use all types of to remove the toxicity from the body, ulcer, wound. Okay, not only in the worms, I already told you that externally the effect of the worm, internally also the effect of the worms is producing by the body or environment. You can use word two. Okay, so this is the very important remedy in electrohomeopathy. Some doctors, what they do that if initially they are not getting the results, they start the remedy with Ver2 because they want to remove the toxicity from the body. So initially they will start the treatment with Ver2. Then afterward, they will give the main treatment. Again, at the ending, they will give Ver1 or Ver2. Okay, at the ending of the treatment. Okay, so some doctors do like that. So we can also do, there is no issues. Okay, so I think you understood about F2, VAR1 and VAR2 completely. Tomorrow we will talk about another remedies.